you to speak to this group we have here, what is one thing that you want to leave this group with? Just, what is that call that you would want to make, your clarion call, or, some kind of summary you want to share with the group? I'll start with you, Dr. Tesfaye.
Okay. So at the end of the day, we want to deliver a positive message towards our audience about the vaccine. Like, we're not trying to, brainwash people's mind. We're just trying to tell what is from our experience and what we have been seeing. And we have seen as a physician, as a practicing physician, we have able to witness lots of diseases in the line of COVID-19. So better to take the chance to at least prevent the society from more damage which has been made so far. From more losses, we have to prevent the society by just trying to change people's mind in a truth base. That's what I want to say.
Thank you so much, Dr. Tesfaye. And Dr. Godfrey, over to you.
Thank you, Dr. Kechi. For me, the critical thing is that COVID is by and large two epidemics. The clinical and the technical epidemic, where people like Dr. Panagis are making a huge impact. But the social aspects, the cultural aspects, the economic aspects, I think call for a slightly different or an extended approach, which brings in the community leaders, the cultural leaders, in order to address some of the misconceptions, some of the rumors, and to listen to what people are saying about the vaccine and correct the misfortune. So, message, let's listen more. Let's expand our reach and go beyond our usual health workers.
Thank you, Dr. Godfrey. And Dr. Panagis, over to you.
So what I would say to everyone out there is, when you engage your community, what I would probably start with, the phrase that I always emphasize is, what are you doing to help us end the pandemic? Because if you scale it at that context, people will have responses, right? It actually takes away any potential conversation of sabotaging, right? Well, I don't trust this or that. You ask them point blank, what are you doing to end the pandemic? How are you helping us? Because it's killed millions. So that's how I would phrase it, and let your audience begin to give you that feedback, to which then you can begin to implement, like, well, that's how the vaccine works, or that's how face mask works, etc. Tackle the community by actually making them realize the responsibility really is on them, it's on all of us. So that's what I would strongly encourage.
Thank you, Dr. Panagis. And Dr. Yabo?
What I say to people now is that we have millions of people around the world that have been vaccinated. We are not special. So I think to say, like, this is nothing new anymore. This is not a clinical trial, it's not a test. Millions, over 500 million people around the world have been vaccinated. Do you want to be part of that or not? And that people are still dying from it. So you still need to be vaccinated and protected because it's still happening. It's not gone.
Thank you, Dr. Yabo. And before I hand over to Dr. Ripka and Dr. Awe, thank you for this opportunity to speak to the audience. I will just say my own parting words. I have been vaccinated since December, so when healthcare workers were vaccinated here. And to Dr. Yabo's point, if I were a guinea pig, if I had a chip, I would have become a robot by now. So look at me as your clinical trial. And I can tell you, I've also been around lots of people that have got COVID. And, one confidence I have is that even if I have it, and maybe I've even been affected or, impacted, but, I have been well. And so what's think about it. You have all the science, you have all the clinical trials. People have been vaccinated for over a year, and you can see the impact of the vaccination. So please take it, because I don't want to hear that anyone in this audience or your family members died an unnecessary death. It is really unnecessary because this is preventable. Thank you so much, and over to you, Dr. Ripka and Dr. Igwe.
Okay, thank you so much. And actually, you promoted me to a doctor. I have MPH, so, but thank you anyway. So I just want to quickly summarize the key points I heard from today's really rich discussion. And thank you very much. And what I heard consistently is about messaging and the messenger, and the need for community engagement and building trust with the community. So all of that is really related to messaging. And of course, that is how we break down this silo, this problem that we have around vaccine hesitancy. So when we think about the messenger, what I heard throughout our conversation is engaging community leaders, government officials that would publicly say that they have been vaccinated, health providers really building trust between the health providers and community, because they are critical messengers, engaging as part of the community leaders and religious leaders. And we will be having ongoing conversation next few series about engaging community leaders. And then also that our collective voice, our collective effort is very important. So each one of us sitting here taking on the responsibility to share information is absolutely imperative. We also talked about, okay, besides the messenger, then the message. So the message is, one, listening to what are critical issues that folks are bringing up as the reasons why they're hesitant, in order for us to be really targeted to addressing change, because this is about behavioral change, is really to listen, to understand, because in their own thinking, that is their reality. The only way we can address the reality is by listening, trying to understand where they're coming from, and then engage them in conversation to break that reality that they have in their mind. We cannot be judgmental. We cannot laugh at their reasons. We just have to be providing factual information. I also heard what's really important, and Dr. Ayantu and Dr. Panagas mentioned this also, and others, is really also sharing our personal stories. Dr. Panagas talked about how when he comes home, he's like worried about, am I going to pass this on? And Ayantu shared her story about how she personalized the issue around, well, am I going to be infertile? And that's really important to me. So personalizing these stories as we share stories, as we interact with our population, is also very important, because what that brings to people listening to us is that we ourselves are struggling or have struggled as part of our journey. Community engagement is very important. So reaching out to beyond the traditional health providers, really engaging community health workers and community leaders is important, and building trust across everybody. And the way to build trust, I always think about the trust equation that talks about intimacy or the relationship plus credibility. So within that relationship and credibility, then over risk. People are willing to take risk when you have built a relationship with them and you've been credible. So we need to build that trust. So thank you for such engaging conversation. So next series 2 and series 3, we will be addressing the messengers that you mentioned, and we will be addressing the messages. So let's keep building this and bring more people next time. Thank you.
And Dr. Igwe, your parting words. You're not muted.
No, I'm not. Dr. Nama is talking.
Okay.
Okay, thank you all to our panelists. Hopefully we'll get Dr. Evie back. Thank you all for our wonderful panelists. Okay, Dr. Evie, you've fixed your mic.
Oh no, it wasn't me talking. Enoma, are you there? Okay, thank you very much. Thank you very much for coming, and we hope you will enjoy and join us. Please share the message and please join us at the next sessions. We're also running a vaccine survey, and we'll appreciate it if you can fill the COVID vaccine survey run in Africa. Dr. Nama, over to you. So.
Dr. Enoma? Okay.
Yes, thank you. I couldn't unmute myself, so that was the problem. I apologize for that. So thank you everybody for joining us. And this was a very rich, engaging conversation. And as Ripka had mentioned, the next session, which is on November 18th, we'll be continuing the conversation with community leaders, scientists, religious leaders, and other people. So please join us again, spread the word. We would like more people on, and definitely, members of this target community, religious leaders, the community leaders, and definitely the scientists, so we can move forward and definitely increase the population of vaccinated individuals in Africa. Thank you so much and have a good day.
Thank you. Can you put on the vaccine survey slide so people can see that? But thank you, and we look forward to seeing you in a few weeks. Well, please share the message. Thank you.
And the co-organizers, if we can stay on. The co-organizers, if we can stay on. Thank you. Bye, everyone else.